Welcome back to Jersey Matters. As you've seen on the news and maybe you've experienced firsthand, nursing homes were hit hard by the pandemic. But there is a team of people who are trying to make things better. Here's my interview with Andy Aronson, Executive Director of Nursing Home Advocates, New Jersey. Thank you so much for joining us, sir, and for representing nursing homes, because nursing homes have been talked a lot about during this pandemic, sometimes in a very negative way. What have we learned about nursing homes during the pandemic that we didn't know before from your perspective?
Well, Larry, the pandemic has been terrible for nursing homes and for our residents. And of course, our heart goes out to all the residents in our nursing homes who have been struggling with this virus. Nursing homes are the homes for many people in New Jersey, about 35,000 people in New Jersey. And their daily life has been affected by this in immeasurable ways. Very early on in this pandemic, for example, we had to cut down visitation into our nursing homes in March. So you've had a lot of elderly people in nursing homes who've basically been cut off from their families, cut off from their loved ones for a long period of time at this point. So,
let me ask you something right there, Andy.
Yeah.
Was that mandated by either the state or federal government that you stop visitation?
Yes, it was mandated by the federal government initially. Now it's mandated by the state. Many of our nursing homes, of course, though, stopped it even before those mandates came in, knowing the virus was coming, and as a prudent way to try to keep the virus out of their buildings.
Were nursing homes and long care facilities, were they equipped for this pandemic? Did they, in the very beginning, did they have all the equipment, the staff, and the regulations that they needed at the time?
I don't think anyone was equipped for this pandemic. You know, the biggest tool in fighting against this pandemic is testing, and nobody had the testing they needed at the beginning of this pandemic. Nursing homes certainly didn't. And as testing became more prevalent, nursing homes weren't prioritized for that testing. So the answer is certainly not. The second most important piece in fighting the pandemic is the PPE that our staff has to use. Again, nursing homes were not prioritized for that PPE. When the virus first came, the PPE became very short in supply. It was very difficult to get.
Yeah, there's been a lot of focus on nursing homes because, especially initially, well, for instance, in Pennsylvania, 68% of deaths were in nursing homes. In New Jersey, it was 50% of deaths. And in some states, and correct me if I'm wrong about this, they were mandating that they accept COVID-19 patients who were released from hospitals back into there. And they weren't equipped for that, were they?
I think that's true. First of all, I don't think that the numbers of deaths are exactly right when you put them in nursing homes. The number for long-term care deaths that you typically see in New Jersey are among all types of long-term care providers in New Jersey. That's not only nursing homes. So a lot of times that number gets inflated because people use the wrong number, but that's not the number of deaths that occurred in nursing homes.
But the point is the same. It was long-term care facilities and nursing homes that were mandated to accept back COVID-19 patients, right?
Yeah, yes, that's true.
And I know that Governor Cuomo has been blasted for that. It doesn't seem like there's been the same scrutiny on other governors. How devastating was that for nursing homes, those orders?
It's hard to say. I don't like to criticize the state for those orders. At the beginning of the pandemic, nobody knew what they were dealing with. The state government didn't know what it was dealing with. They were dealing with models that showed their hospital systems were going to be overwhelmed with cases, and they were reacting to those models. The priority in the state of New Jersey and some of these other states was to protect their hospitals. It was to protect their hospitals from the overflow of patients. And one of the things they decided to do was to make sure those elderly people could go back to nursing homes instead of staying in the hospitals and taking up those beds. Also, at the same time, you had people telling nursing homes to not transfer their patients to hospitals at that time. Make sure things like DNR orders were in place and DNH orders, do not hospitalize orders, were in place, so that nursing home residents weren't going to hospitals.
Let's get some positive out of this, though. What did we learn from the pandemic that we can build from, that we can fix when it comes to nursing homes and long care facilities?
Sure. Well, the good news is nursing homes in New Jersey are now doing a far better job in dealing with COVID. As I've said earlier, There are really three tools to deal with this pandemic. There's testing, there's PPE, and there are staffing. Those are the three things that nursing homes all need to deal with this pandemic. And as our technology grows with regard to testing, facilities had the opportunity now to stockpile their PPE. Things are far, far better in New Jersey, and the rates of infection in New Jersey nursing homes are very low at the moment.
More staffing? Do the nursing homes need more people?
What they need is emergency staffing. So what happened in the spring when this virus hit so hard was it also hit nursing home staffing. So the staffs of facilities had to now stay home and be quarantined during a period where they were exposed to the virus. So the nursing homes didn't have emergency staffing coming in, and many nursing homes were operated with very little staff at that time. So what we need, and what some other states have done, is to set up emergency staffing through the National Guard and some other situations to try to send in like strike teams to a nursing home whose staff was hit by the virus. So if for some reason your facility gets hit by the virus and you're low on staffing, there could be like a strike team or some emergency staffing team to go in and provide support for those period of time where your staff has to be quarantined.
There was a criticism of nursing homes, and especially the state at that point, that family members were not able to get information about their loved ones. They'd just call and call and call and call. And there were some awful examples of that where their loved one had died and they weren't able to get the information in time. Has that problem been fixed?
So this is one of the places where we're really looking at right now. The communication's gotten a lot better. Most nursing homes have gotten technology, things like iPads and things like that, to help the family communication. But really, we believe that the communication is never going to be perfect unless we're open for visitation, unless you actually let family members into the nursing home to see their loved ones and to see what's going on. There are always going to be questions. So right now we're dealing with a situation, for example, where the federal government last week issued guidelines that require nursing homes to be open for indoor visitation if they haven't had a COVID case in 14 days and their community infection rate is less than 10%. We have to be open for visitation, but the state, on the other hand, does not allow indoor visitation.
Do you think they ever should have shut off visitation?
Yeah, I think we had to shut off visitation in the spring. Nobody knew what was going on with this virus or how it was spreading.
Well, everyone has that wasn't thinking about nursing homes before is thinking about them now. You certainly have the nation and the area's attention, and so hopefully some good can come of this. And I know you're on the forefront of that, so good luck to you, sir.
Thank you, Larry. Greatly appreciate it.
Andy Aronson, Executive Director of Nursing Home Advocates New Jersey. When we come right back, are you having a hard time finding childcare during this pandemic? There's a place you can go for help. We'll explain when we come right back.